Welcome to the first of what we hope will be many installments in a feature we think many of our CCSVI patients will find useful and hopefully at least somewhat informative. This is our Ask the Doctor feature. And what we have done is, to begin with, we've collated some of the most frequent questions that we get asked by patients either on the phone or in person when we're seeing them for their procedure. And we are going to endeavor to answer those questions in a way that will help patients to understand what we do here at the Rhode Island Vascular Institute. So the first question that we thought would be useful, and one of the most popular questions that people have, is how does the venogram and the angioplasty itself work? So what I thought I would do today is just present a very brief overview of how we achieve the procedure and how we perform the angioplasty itself. First part of the procedure is for us to gain access to the venous system, and some people talk about the venous system as a highway in the body. The way we do that is by using ultrasound guidance to make access to one of the large veins in the groin. Once we've made access to that vein in the groin, we use X-ray guidance to steer one of our catheters, and a catheter is a medical term for a tube that we use to steer through the system of the body. And one of the catheters that we happen to use is this one, which is called an H1H, or a headhunter catheter. The catheter is steerable, as you can see, and using X-ray guidance and wires which run through these catheters, we steer these catheters up into the veins of the body that we're going to interrogate. These are catheters that we've used for obviously many, many years interrogating other veins. Now we're using to look at the jugular veins on each side of the neck and the azygos vein back behind the heart. So that's the catheter that we're using. Once that catheter is in place, we inject the catheter with a contrast. Some people call it dye. It's really more of it's a clear substance, and X-rays pick up the substance and shows up very well on X-rays the pictures of the veins. It tells us a lot of fine detail about what's going on both in the wall of the vein as far as how the vein is acting from a flow standpoint. Once we find an abnormality in the area of the vein, usually at the base of the neck, we do what's called an angioplasty. And an angioplasty is the medical term for using a balloon to open up a blood vessel. And the blood vessels we're opening up are typically the jugular veins and the azygos vein. People often ask, is the balloon left behind? Well, it's not. This is the balloon that we use. The balloon is placed through the same access that we used for the original venogram. Once the balloon is in place, inside the abnormal segment of the vein, under X-ray guidance, the balloon is attached to a little, what's called an insufflator. This is a special pump that tells us the amount of pressure we're generating. And then and I'll hold this here so you can watch what's going on, we inflate the balloon, and the way the balloon inflates, you should be able to watch here, is something along these lines. And these balloons are inflated at very high pressure to open up the area inside the vein that's narrow. And when the balloon gets to the pressure it needs to be at to open up the narrowing itself is cracked or permanently stretched. Often that's at a valve level. When we get done, we release the pressure on the balloon and remove the balloon fluid, bringing the balloon back down to its original state without any of the fluid inside. And then we remove the balloon over the wire, and we reinsert the catheter over the same wire and perform the venogram to see that we've achieved our intended goal, which is to get to a size that will keep that vein open and increase the flow and hopefully provide clinical benefit. Thanks.